You sit across from your patient. After a few months of treatment, their symptoms have faded, and they tell you they feel better. As a naturopathic doctor, you see this kind of healing every day. But your treatment program likely involved multiple, overlapping strategies. A single patient might receive dietary modifications, a new yoga routine, hydrotherapy sessions, and targeted sleep counseling all at the same time. If you look at this diagram mapping out a standard naturopathic treatment plan, you'll see a complex web of interventions: diet, yoga, hydrotherapy, all feeding into the patient's recovery. The problem is, when the patient improves, it is incredibly difficult to isolate what exactly drove that improvement. Did one specific therapy do the heavy lifting, or was it the combination of all of them working together? This uncertainty forces a shift in how you practice. You move away from saying, "I believe this program works," and start asking harder, more precise questions. Does it actually work? For which specific patients? How much does it help? And what are the actual risks? Clinical intuition is an excellent starting point for treating individuals, but relying on intuition alone is insufficient for building a modern, credible, and scientifically grounded medical discipline. To do that, you need rigorous evidence. This diagram shows how we transform a standard clinical thought into a measurable research query. Instead of asking a vague question like, "Does hydrotherapy help blood pressure?" we break it down. We specify the population, the intervention, the comparison, the outcome, and the timeline. Now we are asking, in adults with mild hypertension, does regular hydrotherapy, compared with usual care, meaningfully reduce blood pressure over 8 to 12 weeks? By defining exactly who we are treating, what we are comparing it to, and when we measure the results, we create a testable hypothesis. This exact structure is the required foundation for all evidence-based practice. Once you know what to ask, you start searching the literature. But finding a published paper doesn't automatically mean its conclusions are reliable. You have to evaluate the methodology to see if you can actually trust how the researchers reached their findings. Take a look at this bar chart. A study might boast a 30% reduction in patient pain. That sounds impressive, but when the chart zooms out to show the full clinical scale, you see that the pain score only dropped from a 7 out of 10 down to a 6. The statistical percentage is technically true, but the actual relief is barely noticeable to the patient. To avoid falling for weak data, you apply red team thinking. Instead of only searching for studies that confirm the benefits of your therapies, you deliberately search the literature for adverse effects, limitations, and direct comparisons to other treatments. You actively try to prove yourself wrong. If a belief you hold about a specific treatment is incorrect, you ask yourself what kind of evidence would reveal that flaw, and then you go look for it. This continuous stress testing of your own assumptions is the defining trait of a true clinician researcher. As you dive deeper into the research, you'll encounter gaps. Finding only 2 small studies on a therapy doesn't mean the treatment fails. It simply means we lack the data to know either way. But if several well-designed trials consistently show 0 benefit, you now have strong evidence of no effect. This graphic illustrates how a meta-analysis works. When you have multiple studies on a single treatment, some showing a strong benefit, some showing none, a meta-analysis pulls them together. It mathematically weighs all those scattered data points and merges them into a single, precise average, giving you the overall effect of the treatment across thousands of patients. We then apply systems like GRADE to evaluate that final data point. GRADE assesses the risk of bias, sample sizes, and inconsistencies to tell us exactly how confident we can be in that result. Armed with this synthesized data, your conversations with patients change. You can clearly explain the potential benefits, the known risks, and the specific areas where the science is still uncertain, communicating clinical realities with absolute scientific integrity. Reading other people's research is only the first step. The real opportunity comes when you turn your own clinic into a source of new, vital evidence. This split screen compares 2 ways of documenting a patient's visit. On the left, a traditional clinical file ends with a brief, subjective note stating the patient improved. On the right, we see the rigor of practice-based research. Here, you systematically track a matrix of data: symptom scores, specific biomarkers, diet adherence, and quality of life metrics at precise 2, 4, 8, and 12-week intervals. When you apply that level of tracking to a single patient, you get a great case study. But when you record that identical matrix across 100 appropriately selected patients receiving the same program, the data compounds. All of this knowledge feeds into your personal evidence library. You build an organized database for every intervention you use, mapping out exactly how strong the evidence is, which populations benefit the most, and when a treatment should be avoided entirely. In this model, the practitioner functions as a clinician, a researcher, and an evidence synthesist at the same time. By meticulously measuring exactly what happens in your own practice, you contribute the evidence required to build a credible future for naturopathy.